Next on our agenda is I'm going to share the statewide results from the survey. I'm going to kind of go through it quickly because I don't want to bog down in a lot of data, but I just kind of want to show you the responses we got because this was our first step in assessing what we needed to do workshops in. So we distributed our surveys through the Maryland Deans and Directors listserv, and we distributed to 25. There are 25 Maryland schools of nursing, and we had 17 who responded, so it was a 68% response rate. So that's, I think, an excellent response rate. One of our first questions is, what's the first word that comes to mind when you hear NextGen? And people had a lot of ideas, but when we did a word cloud, difficult was the biggest word, and I think that's how we mostly feel. And I think that as we present these workshops, we can help you feel like it's a little less difficult. So we took all that into consideration, and our workshops are going to be hands-on, practical, helping you learn how to use different things. We rated on we asked people to tell us how knowledgeable they were. And for the most part, people are feeling pretty knowledgeable about what's going on with NextGen. That was the deans and directors' knowledge. And then the next question was, what is your faculty's knowledge? And that was surprising. One felt like maybe their faculty didn't know as much as they hoped they would know. Most felt that their faculty were somewhat knowledgeable. Rate on, let's see if I can pull it down. Go back one. Rate on a scale of the readiness to implement. Most of the schools are saying they are slightly ready. The next level would be moderately ready. So people are feeling a little uncomfortable about their readiness. Has anyone been appointed? Who's been appointed to coordinate the changes? And it looks like it's spread out. But if you look at number 3, 19.23% are 5 schools report that they're expecting the individual faculty members to coordinate the changes, which is kind of interesting to think that the individual faculty without support, as we talked before, having a pit crew is an interesting concept. And 6 people said that they haven't appointed anyone to coordinate the changes. So hopefully that will change. Some people have found an NCLEX mentor, and I'm not sure what that is, so we'll explore that a little bit more. What clinical judgment model are you planning to use? Looks like the majority are you going to use the nursing process. The next, it would be Tanner's clinical judgment model, and then the third would be the National Council's clinical judgment measurement model. So people are thinking about the judgment model they want to use. One respondent was they weren't aware that there were different models. I think it gets a little confusing sometimes. What are your learning environments that you've begun to process of adapting clinical judgment? And things like classroom, simulation, and clinical are running about equal. So people have been thinking about this and understanding that it's not just one place, that it's all places you get clinical judgment incorporated. To what extent have faculty teaching in the classroom or online started to develop or adapt their teaching? And the majority are saying somewhat ready. Faculty have recently begun the process, so that's good news. That's positive. Clinical environments. Have you been adapting your teaching strategies in the clinical environment? And once again, about 56% are saying somewhat ready. They begin to think about it, but 31% are saying they're not ready. So that'll be something to really maybe attend some of those workshops we have on clinical instruction and incorporating clinical judgment models. Skills Lab. Feeling pretty good there. Looks like about 10 of the respondents felt that their faculty was somewhat ready to implement this in skills labs, which is it's good. In simulation, about half are saying they are somewhat ready. They're thinking about using it in sim. 25% aren't. Some are getting close and some are really ready. So it's a little bit over, but a majority are somewhat ready. Test blueprint. To what extent have faculty begun to modify their test blueprints? Most are not, haven't looked at their blueprints yet. So hopefully those workshops will be useful. To what extent have faculty begun to develop and use NextGen type questions in course exams? And it's about split. Not at all. Some faculty haven't even begun to do those questions, and then some are moving towards it. So I think those workshops we have on the test questions will be very useful. To what extent have faculty, I can't read what that is. Let's see. We conduct an item analysis. So it looks like most are not quite clear or sure how to do an item analysis. So once again, those workshops we offer on tests and assessments will be very helpful there. So we were trying to understand what kind of learning systems people have, just trying to get a sense when we do our workshops, you know, what people are coming to us with. And it looks like Blackboard is the largest one, and other is the next one. And I think my next slide lists out some of the other. You can see Exam Master, D2ZL, ExamSolve, Brightspace. So you can see that there are other things going. We just wanted to understand where our schools were with their learning management systems so we could help them. What exam software does your program use to administer exams? Majority are using ExamSoft. Next are using Exam Master. Others are not using any. And some are using Blackboard Respondus. So if you're using a standalone software or your LMS to administer tests, this software have the capability of presenting and scoring the NextGen type questions. Most of you don't know. You don't know whether it can or not. And that'll be some of the things we will work on in the workshops to understand how your system can do it. Does your program use a product to determine readiness for the NCLEX exam? And it looks like about 44.4% are using ATI. Others are using Kaplan and HESI, and those are the names we typically hear, and Hearst Review. Those are pretty much the predominant ones in our schools. Does your program use an exam proctoring service? Looks like most are using the Respondus Lockdown browser. And let's see what they say for other. They're using ProctorU, HonorLock, and so it looks like that's some that our programs are using. Given unlimited resources, which test authoring software systems or services would you purchase for your program? And looks like the majority would go with ExamSoft and ATI. And the reason we asked that question, because we're kind of thinking about what kind of resources we might be able to offer some of the schools. So we're in the process of evaluating that. Some are looking at UWorld and others. To what extent would a workshop on using the following teaching strategies develop a clinical judgment skills will be helpful to your faculty? And I would say on a scale of 1 to 4, majorities are going in the 3.5 and higher. So our workshops are are around this. So I think we're on target. We use this data to help us set up our workshops. So the feedback, the assessment, helps us understand we're targeting the right areas. To what extent would a workshop on writing, using, and administering tests with the NextGen type questions be helpful? I think you can see here that the majority of folks feel like just about everything that we're going to offer would be helpful, and we will definitely have some really beneficial workshops on testing and assessment. And then we just wanted some demographics. Most of our respondents were from ADN programs, which are the majority of the programs in the state. So it's a good representation. And how many students are currently enrolled? You can see that we have a range. We have 5 schools that do over around 200 to 250, and then we have 5 schools that do over 251. So this is good because we have a nursing shortage, and it's good to know that we have programs that have high enrollments, and this is positive. So we want to make sure all those students that graduate pass that NCLEX and become licensed practicing nurses. And how many campuses? Most of our schools only have 1 campus. We have some that are on 3 different campuses, and we have 1 that's on 2 campuses. So that just gives us a sense of geography and how schools are having to make sure all campuses are doing the same. How would you describe your program? Good mix. We've got rural, urban, and suburban, so we had good representation on our test. And how would you describe your program? Most of our programs are on campus, and 6 are in a hybrid model, and this was answered during the COVID response. So that is about what we thought it would be.